All right, let's jump right in. Today we're tackling a really interesting and kind of complex condition, autoimmune hepatitis.
So, picture this. Your body's own defense system, the one that's supposed to protect you, suddenly declares war on your own liver. What on earth happens then? Well, that's exactly what we're going to unpack.
Okay, so first things first, let's get right down to the core concept. What is autoimmune hepatitis, really?
In a nutshell, autoimmune hepatitis, we'll call it AIH for short, is this chronic condition where your immune system gets its signals totally crossed. It starts attacking your own healthy liver cells by mistake. You can think of it like friendly fire. And this attack causes non-stop inflammation, which, as you can imagine, leads to some serious damage over time. And the really tricky part? We still don't know exactly why it happens. It's still a bit of a mystery.
Now, while the cause is a mystery, researchers have definitely spotted some key patterns. For one, it shows up most often in young women. It's also frequently connected to other autoimmune issues, which kind of hints that the whole immune system might just be, well, a bit overactive. Patients also usually have something called hypergammaglobulinemia. I know that's a mouthful, but all it really means is they have super high levels of antibodies in their blood. And finally, there's a genetic piece to the puzzle. Scientists have linked it to specific genetic markers, HLA-B8 and DR3, which suggests some people might just be more predisposed to it.
Okay, here's something you need to know. AIH isn't just one size fits all. It's more like a family of conditions. Doctors have broken it down into 3 different types, and they figure out which is which by looking for very specific clues in a person's blood.
So let's look at how this breaks down. Type 1, that's the most common one. You'll see ANA or SMA antibodies, and it can affect both adults and kids. Then there's type 2. It's much rarer, it's marked by these LKM1 antibodies, and you pretty much only see it in children. And finally, type 3, this one is tied to soluble liver-kidney antigen antibodies, and it usually pops up in middle-aged adults. So yeah, you can really think of these antibodies as little flags that tell doctors exactly what kind of attack is going on inside.
Right. So we know what it is, we know the different types. But what does it actually feel like? How does it present itself? Let's get into the telltale signs.
And this is where it gets tricky, because the symptoms are all over the place. For some people, it's a slow burn. They just gradually develop signs of chronic liver disease. For women, a really common sign is something called amenorrhea, which is just the absence of menstruation. And that makes sense, right? The liver plays a huge role in hormones. But then you have the other end of the spectrum, a full-blown acute hepatitis where someone suddenly gets a fever and jaundice.
But get this is the part that's really surprising. Only about 25% of patients show up with those really dramatic acute symptoms. Just 1 in 4. So think about that for a second. For the other 75%, this thing is creeping up on them, working silently in the background. That's a wild statistic, isn't it?
And that leads us to a really crucial point. For most people, the onset is subtle. It's gradual. It's this stealthy progression that makes AIH so hard to pin down early on because the symptoms can so easily be brushed off as something else.
So, with such a mixed bag of symptoms, how did doctors actually nail down a diagnosis? How do they get to a firm conclusion? Let's follow the clues and walk through that process.
It really boils down to a 2-step investigation. First, they run detailed blood tests, and then, for the final confirmation, they do a liver biopsy to get a look at what's happening right at the cellular level.
So, step 1, blood work. Doctors are on the hunt for those specific autoantibodies we talked about earlier, the ANA, SMA, and LKM1. They also look for raised levels of something called IgG. IgG is just a really common type of antibody, and when you see a lot of it, it's another huge clue that the immune system is in complete overdrive, pumping out way too many weapons. These are the first major breadcrumbs on the trail.
But the real smoking gun? That comes from the biopsy. A pathologist looks at the tissue under a microscope, and they're looking for something specific. They see inflammation that's actually breaking through a boundary in the liver called the limiting plate. This process has a name, piecemeal necrosis, and it's the visual proof, right there, that immune cells are literally destroying liver cells, piece by piece.
And there's another thing they look for, called bridging necrosis. It sounds complex, but the idea is simple. It means the damage isn't just in one little spot. It's actually forming these bridges of inflammation that connect different parts of the liver, and that tells them the attack is much more widespread and much more serious.
Okay, so a diagnosis has been made. What happens next? This is arguably the most important part, especially for patients. What's the game plan? Let's talk about management and treatment.
You can think of it as having 2 main strategies. The first line of defense is all about calming the immune system down, suppressing its attack to stop any more damage from happening. But for those more severe or advanced cases, maybe where the liver's already really scarred up or the meds just aren't working, the strategy has to shift to something more significant.
So what are the tools for that first-line defense? Well, they're called immunosuppressants. Doctors often start with steroids, which act fast to put out the immediate fire of inflammation. Then they'll often follow up with drugs like azathioprine, which are designed to dial back the whole immune response for more long-term control.
And what if the medications just aren't enough? Or what if the liver has already gotten to a state of cirrhosis, which is severe scarring? Well, that's when liver transplantation becomes the absolute, vital, life-saving option. You're essentially swapping out the damaged organ for a new, healthy one.
So after all that, what's the big takeaway here? Look, there's no question, autoimmune hepatitis is a serious, chronic illness. But, and this is the really important part, it is manageable. With the right diagnosis and a good treatment plan, that misguided immune attack can be brought under control. People can and do manage this condition and live full, active lives.
And that leaves us with one last big question to chew on. The root cause of AIH and so many other autoimmune diseases is still a mystery. So what's the next frontier for medicine? What's it going to take to finally understand this fundamental puzzle? Why does the body sometimes turn on itself?